health equity. The academia and the persons who are involved in research at the WHO and other places speak about equity in health. And the minister has been talking a lot about equity in health. When we speak of equity in health, we speak of the input of infrastructure and resources to improve the lives of the people at their first point of contact with the health sector, despite their social station in life. That is what we call equity in life. Improve the system for the first point. With that clarification, Mr. Speaker, in the last financial year when we were there, 31 health centers were refurbished under the previous government, the cost of $359 million. We also spent $1.2 billion on the improvement of hospitals. $300 million was spent to acquire state-of-the-art X-ray equipment for Princess Margaret Hospital, Linstead Hospital, Cornwall Region Hospital. The availability of the new equipment improved access to diagnostic tests and remove the burden from the people to pay for these services privately. This is what we call equity in health.